To share that we're the first hospital in India to get the dual certification from American Heart Association for both chest pain and stroke center. So now I would like to share some of the important things about stroke, why it is so important. Indian data shows that 30% of Indians are dying every year only because of two diseases. One is heart attack and stroke. Combinedly, both stroke and heart attack kill almost 30 to 35% of Indians annually. And if you see Karnataka itself, we are having almost 1 lakh stroke cases every year. And we are getting almost patients with stroke with disability. Almost 5 lakh people are getting, living with significant disability because of stroke. There has been a huge change in last 20 years in stroke management. How do you approach stroke? How do you treat stroke? If you see, stroke has maximum myths. That's why many people are not coming to the hospital on time. There is a data published by government in January which showed that almost they studied around 35,000 stroke patients across 30 states in India. They say that though so much of advances have happened, only 20% of patients are coming in golden hour with acute stroke to hospitals. And only 4.6% of patients are receiving the clot busting medication, which is life saving. And worse than that, only 0.7% of deserving patients in India are getting the brain angioplasty, which is called mechanical thrombectomy. This shows how much lacking we are in delivering skill or care. Though we have all the equipped services, patients are coming not in the golden hour. In our own hospital, we are already having almost 2 acute stroke admissions per day, but most of the patients are referred when they are getting complicated in some other hospital and things like that. So there is a lot of gap in the knowledge and also awareness in the public about stroke. So we want to, Apollo has initiated a lot of activities and lot of things to spread awareness about stroke. The first 4.5 hours after the onset of stroke symptoms is called the golden hour of stroke, wherein we can give the clot busting medication that is called IV thrombolysis. Now, how do you diagnose an acute stroke patient? There is a synonym called B-FAST, BE-FAST. B stands for loss of balance, E stands for eye signs, that is called blurring of vision or loss of vision, F stands for facial deviation, A stands for arm or leg weakness, S is for speech difficulty, and T is time to call ambulance or time to call for help. So, if you know this B-FAST symptom, almost you can pick up 90% of the stroke. Stroke can happen anywhere. It can happen in a public place, it can happen at home, it can happen in an office, or it can happen in mall or anywhere. So, if the patient is brought to emergency within 4.5 hours, we can do what is called IV thrombolysis. Up to 24 hours, we can offer the treatment called mechanical thrombectomy. If there is a major blood vessel in the brain which can get blocked, we can help these patients by relieving the clot. This we have been doing for last 15 years in Apollo, but now probably the time for us to spread the message to everybody so that patient gets the benefit. Every minute after acute stroke, 1.9 million nerves are going to die. If you delay the treatment minute by minute or hour by hour, brain is going to get irreversibly damaged. So we have 1 hour protocol in Apollo, which is the international benchmark suggested by American Heart and Stroke Association. What is that 1 hour benchmark? The door to needle time, what we do in most of the stroke pathway, is called the international benchmark. Patient enters to emergency. Within 10 minutes, patient will be assessed by the emergency team doctor. Once they know that there is a stroke or clinically they suspect stroke, there is this one called code fast. So hospital address system will announce code fast. Then everywhere whoever is the responsible person will attend the patient. Within 15 minutes the neurologist or the neuroscience team is going to evaluate. Within 25 minutes MRI or CT will be done. There are many instances wherein some MRI is going on. The moment we announce code fast, they have to stop that particular patient MRI, pull the patient out, take this stroke patient in. And within 45 minutes we run all the blood tests, angiogram and ECG and everything. Within 1 hour we are going to administer the clot busting medication. This is the international benchmark. It is 60 minutes. In Apollo, we are able to achieve an average of 45 minutes. And after that, patient will be shifted to ICU, and then other treatment will start. If there is a major large clot, we are going to shift the patient to cath lab. We have 3 cath labs. In two cath labs, we have a CT scan in the cath lab, so that if there is a bleed in the brain, we can pick up in the cath lab only. And after that, we are going to shift the patient to ICU. Now, next thing is about the rehabilitation. Most of the patients don't know that once patient's acute stroke is over, then you take the medicine, patient becomes better. It is not like that. There is a dedicated rehab program which has to happen everywhere. You may be knowing Dr. Raghavendra Rajkumar had stroke 11 years back. He went to Singapore. After that, he came in the same position. Then he went to rehab facility. Now he is walking. He is our brand ambassador actually for our stroke support group. So rehab is as important as the acute stroke treatment. So stroke program is not one person effort. It's a team effort, starting from the identifier of the stroke symptom to the ambulance driver to the emergency team to neuroscience team to radiology team to lab to ICU to rehab. So this coordinated effort is most important in saving the life of the patient. So with this, I would like to again thank all of you for coming here, and again thanks to my colleagues.